In this video, we're going to learn a little something about some bone markings and the vocabulary we use to describe bone markings. And I will tell you the bone markings are the hardest thing that students find to learn in these bone labs. So if you know some of the vocabulary and what it means, sometimes it can help you guess an answer on the test. So let's start with our list here, and let's first look at a ramus. So a ramus is a bar of bone. So see how this bone has this bar of bone sticking up here at like a right angle? That's your ramus right there. Now also on here we can see some processes. Processes are parts of your bone that are sticking out. So see how this area is sticking out right there? Here's another process right there. So these processes are the areas of the bone that are sticking out, and usually there's a bone or a muscle pulling on these, and that's what caused this process to form. So we've got processes and ramus, and you can see both of those on this bone, which is the mandible, the lower jaw. Now let's look at the femur for our next two markings, and in this we can see trochanters. Trochanters are blunt, irregular processes. So right here, see this bump sticking up, and it's kind of got a very blunt, irregular shape to it. That's the greater trochanter, and here's another process down here. That's the lesser trochanter. So blunt, irregular processes are called trochanters. Now, if we want to see our next marking, we need to go on the tibia. So this is the tibia, your shin bone, basically. And right on the top of the tibia, the front of your knee right here, you can see a large potato-like bump. So this is called a tuberosity. So a large potato-like bump is a tuberosity. So there's a good example of a tuberosity for you. Now, on our next bone, the humerus, we're going to be able to see two good examples of tubercles. So we had a tuberosity, which was a large potato-like bump. These are tubercles. They're smaller potato-like bumps. So see, there's a bump here and a bump here. These are two tubercles that are present on your humerus. So tubercles are small rounded process, small rounded potato-like bumps. Next up on our sacrum right here, there's a good example of a crest. So see this spiky part that's sticking up right there? That is a crest on the sacrum. It's called the sacral crest. So whenever you have a sharp protrusion of bone sticking up like this, see how I'm able to run my fingers along it? This would be an example of a crest. Now there are also smaller protrusions that are called lines, so you can usually see these on the back of the head, and if you're ever walking behind a bald man, sometimes you can see two lines on the back of his head. These are called the nuchal lines. So there's one line, and then there's usually another one a little bit higher up, but these are much smaller protrusions and sometimes not even present on certain skulls. Now our next marking is called a spine. So on the back of the scapula, that's the name of this bone, see this sharp protrusion that's sticking out, and it's pretty huge. So a sharp, slender, pointed projection, this is a spine. So this is called the spine of the scapula. So the sharp projection right here, that is a spine. So that's a good example of a spine. Now on most of the long bones, like this femur, you've got a head and a neck. So the head is usually the part where it interacts with the other bone. So for example, this fits into the os coxa and they go together like that. So the head is the part that sticks into the socket of the joint right there. So that's the head of the femur. And then see how there's a skinnier part of bone right here? That's called the neck of the femur. And if you're in emergency health, you're going to be very familiar with that, because when most older people break their hip, it breaks right there along the neck of the femur. It just breaks, snaps right there. This part falls that way, this part falls that way, and then the person is in a lot of pain, bleeding, and is probably calling you in the ambulance to come and help them. So here's a head and here's a neck on the femur bone. Now let's look at some condyles and epicondyles, and again we can use the femur for that. So at the bottom of the femur, see how there are these rounded projections sticking out? These are called condyles. So there's a condyle and here's another condyle. So see how they're round from rubbing together and interacting with the other bone that they go together with, the tibia. So the condyles are rounded projections that help to form a joint. So that's a condyle and that's a condyle. Now, an epicondyle is on top of a condyle. So this is my condyle, and see that bump that's right on top of the condyle? That's an epicondyle. Here's one over the other side. This bone's been a bit beat up, but here's an epicondyle, and then here's my condyle. So the epicondyle is on top of the condyle right there. Let's look at a trochlea. So on my humerus, which is the bone of my upper arm, you'll notice that as you come down towards the elbow right here, see there's a pointy part sticking out right there. That's the trochlea. So a trochlea is a smooth grooved process that's shaped like a pulley. So that is a trochlea right there on your humerus bone. Let's see if we can find a facet on something. Usually these vertebrae have facets, but unfortunately I seem to have pulled out one that doesn't have a very good facet. I'm trying to see if I have something else that has a facet. But you can kind of see one here. See how this is making a kind of a flattened area where something has been rubbing against here repeatedly over time, and it kind of looks a little flattened. So that right there where I'm putting my finger is a facet. And there's another one on this side. Here's another facet. So there are areas that are smooth and flat because something has been rubbing against them repeatedly. You can see a lot of them on vertebrae, and you can also see them in other bones that we're going to study. Now let's look for some fossas. So fossas are depressions. So right at the back of the humerus, so this is the humerus again. See right here, there's a basin-like dip. See, I can put my finger into it. So this is a fossa. On the front, here's two more little pits, two other little basins. That's a fossa, that's a fossa. So any of these little basins that are in bones, they're all called fossa. So a fossa is a shallow basin-like depression. Now, if we want to see some foramens, here's a good example right on your os coxa. Remember, foramen is a hole. Is this a hole in my bone? Yes, it is. Look, I can put my finger through it. So foramens are holes in bones. So there's a lot of examples of foramens. We're going to see many of these as we go through, especially if you look inside the skull right there. See this big hole that I'm putting my finger into right now? This is called the foramen magnum, which in Latin means big hole. So a foramen is any hole. So see, there's lots of foramens in there that we have to learn about. Lots of holes, and blood vessels and nerves pass through those holes. Now, also on this skull, we can see another important marking, which is a meatus. A meatus is a tunnel. So when you want to hear sounds, the sounds are picked up by your ear and sent through into your brain. So we need a tunnel that goes from the ear into the brain in here. So there is a tunnel that goes from the outside of your head to the inside of your skull, and it brings the sound through through to your brain to be analyzed. So this is called a meatus. A tunnel is called a meatus. Let's look at some fissures. So in the back of the eye sockets right there, you can see this hole that's kind of like a slash through. And there's another one there. So it just looks like a slash. It's not a nice round little hole. It's like a gash or a slash through the back of the eye socket. Those are fissures. So a fissure is a slash or a gash. And you can also see in here some of the sinuses, some bones that have holes in them. So you can see right here, there's the spaces for air inside some of these bones in the skull. They're called sinuses. So I think that's everything I have to show you in the line of markings. And like I said, this is students' least favorite part of learning about bones. But if you just study it repeatedly and check out lots of diagrams in your textbooks and watch these videos over and over and over again, you'll be able to learn about these markings.